So welcome back to another edition of the Heart to Heart podcast. And my guest today is Dr. Marty Makary. So Dr. Makary is a professor and physician at Johns Hopkins University, and he's also the author of the best-selling book, The Price We Pay. So Dr. Makary, welcome to the show.
Great to be with you, Mike.
And just so the audience knows a little bit more about you, is there anything there that I left out in the intro that we should know about before we get started?
No, I trained in public health at the Harvard School of Public Health and then did my clinical training in surgery. And so I'm a surgeon, but have been doing active research on research methodology, evaluations of good research studies. And research has really been my career at Johns Hopkins. Now I spend most of my time in research and have since around the opioid epidemic. And of course, when COVID hit, there was an opportunity there to start answering research questions that nobody was really positioned to study. So that's a little bit of how I got deep into COVID. I was editor-in-chief of the second largest trade publication in medicine called MedPage Today. So when COVID hit, I really felt an obligation as editor-in-chief to get it right and understand what was happening. So I started sounding the alarm before it hit. And that, of course, just sort of put me in the middle of a political back and forth where people were saying, no, this is not that bad. Don't create any hysteria here. COVID is not a real thing. So a bunch of us were out there warning about it before it actually happened. And that's kind of how I got thrust into the whole COVID world.
Interesting. Well, yeah, I think we're all kind of got thrust into it eventually as physicians, and obviously everyone, in the world has been thrust into the world of COVID because it does affect everybody. But since you are from Johns Hopkins University, maybe we'll start there. There was a paper that came out last year that highly criticized lockdowns and basically said that they provided very, very limited benefit. And I was wondering, as a physician and professor at Johns Hopkins University, what was the buzz around your colleagues with that particular paper? And do you think that the conclusions were accurate, or do you think that they were a little bit misguided?
Look, it was a very sophisticated analysis, and I think the conclusions were entirely logical. They did as good of a study as you can do. But here's the new world of research in medicine. Research that you don't like, you ignore, and you find something wrong with it. It's sort of like, if you have a girlfriend and you don't like the girlfriend, even though the girl's a great girl, you try to find something wrong with the girl, right? That's basically how people are treating research they don't like. And it's this politicalization of research we've never seen before. So here they did a very elegant study. It completely ignored. And we see this all the time. Vaccine complication research completely dismissed. Natural immunity research completely dismissed. And it's almost like we've reversed the scientific process now. And it's like, if this is in line with what we like or want to say, or could make the opposite political party look bad, then we want it. And if it doesn't, we don't like it, then let's ignore it. So it's this weird world. Even Facebook, there was a famous email that was uncovered. Facebook had basically said, this was in a lawsuit. It was, I think, surfaced as a part of discovery. They said in discussions with the government that they were using their levers to reduce vaccine hesitancy content. It's like, well, the real test should be whether or not it's valid scientific content, not whether or not it could cause someone to be hesitant. If you're a young, healthy 19-year-old male, there's not a compelling case to get vaccinated today. And so it should be scientific, not based on what we like or want. And that's the issue with that study. The study was a good study, but some people just didn't like the results. And I see this over and over again in medicine. I've never seen it before. It's that if we like the results, it's a good study. And if we don't like the results, we say that it had bad methodology or find something wrong with the study, which you can always do. You can always do. I remember Harvard School of Public Health in our epidemiology class. They gave us 10 studies from the top medical journals, New England Journal, JAMA. And these were good studies. And they would say, find something wrong to invalidate all of them. And you would sort of nitpick and try to find something that you could argue invalidated the results. In other words, you can always do that. The question is, what's the quality level of the study? And what can you learn or infer versus what's a false conclusion of that study? You've got to be objective.
And so, it's obviously pretty disturbing for people to hear that, there's studies coming out that scientists basically and physicians and, people will basically just ignore if it's not, supporting their own narrative or the mainstream narrative. So, you said earlier that you've never seen this happen before. So is this something that's, just kind of happened over the past few years during COVID, and if so, why do you feel that it happened only during COVID and why not previously to COVID?
I don't know how this country got so political, so closed to listening, in such a shouting mode and in such a tribal mentality, right? You're either with us or them, or who are you? When I was warning about COVID being a real threat to the United States before the lockdowns and all that, when I was calling for contingency plans and warning the country on CNBC and all over the media, there was this weird response I got, which was sort of this, is he on our political side or is he on their side? I'm like, what are you talking about? I'm just speaking as a doctor. And I saw this in the Middle East because my family is originally from the Middle East. And there for decades or longer, there's been this tribalism of, wait, are you part of our religion or their religion? And if so, maybe you won't get the promotion. Christians in Egypt have a really tough time passing their medical boards in surgery. It's just 10 times harder, or at least it has been for a bunch of folks that I know, surgeons there. And it's kind of like they sniff out that you're a Christian. It's not that hard. They put it on your driver's license in Egypt. And then they're kind of like, you know what? They're a Christian. We're going to make life a little harder for them. And I expected that over there. It's been that way. And people there live with that system. It's not good, but it's understood that happens. And here, for the first time, I thought we lost our impartiality. We all of a sudden we're doing that. Are you with them? Are you with us? Are you supporting this sort of take COVID seriously, COVIDian agenda? Or are you one of these extreme anti-vaxxers, people out there? And it got mixed up in the whole sort of political dichotomy of this country and polarization. And it was weird, right? It was really weird because it's like, hey, I'm a human being. I'm a doctor. And if there's a pothole in my neighborhood, it's not a red or blue issue. It's just a competency issue. So I don't know how things got this bad, but it is bad right now. I mean, basically, you cannot get elected to the National Academy of Medicine. I got in before COVID, but this, prestigious society of select scientists from around the world, I think, there's a couple people a year from Johns Hopkins elected into this international society. You basically cannot get elected into it now if you have taken a reasonable middle ground stance on COVID, giving a balanced approach. You have to be 100% COVIDian extremist.
Yeah, that's really unfortunate to hear, because I do feel that it is, the answer, does lie somewhere in the middle. And, obviously, for, vaccines are probably the most, debated subject throughout COVID. There's other things too, like lockdowns and vitamin D and things, but certainly I think the vaccines have probably, grabbed the most attention from people. And unfortunately, it seems like it's an all or none approach.
Yeah.
We have this tool that can be, potentially incredibly effective for, people who are, very much at risk. If you're a senior and, you have several comorbidities. If you get COVID, you could be in real trouble. If you're vaccinated and you get COVID and you're older, you have those comorbidities, it may prevent you from getting severe disease or from being hospitalized or even dying, which is fantastic. But when you look at males between the ages of 18 to 29, in particular 16 to 29, around that age, I know Tracy Horg, I think I'm saying her name right. She did a very good analysis. She's put it out on Twitter. I put it out on my page before, that indicated that you're actually 28 more times likely to get myocarditis from the vaccine as opposed to myocarditis from COVID in that age group. And also too, that the infection fatality rate for that age group, I believe, is 0.002%. So, exceptionally low. I had to think about, how many zeros I was going to say there when I was, saying that number. So, when you look at that, clearly this should not be an all or none approach. Clearly there are people who are at risk who would benefit from getting vaccinated. Again, referring to, elderly people with comorbidities. But then you look at, a young, healthy male that again has an infection fatality rate of 0.002% and a higher risk of getting myocarditis from the vaccine than from COVID. In that situation, I don't understand how anybody can justify the risk benefit ratio to a male who's between the ages of 16 to 28 years old, roughly that age category. It seems to be ridiculous, and I don't know why we've taken this all or none approach.
Yeah. And we do it in politics. We do it in everything. You hear it all the time with the echo chambers of, the politicalization of, them. And this is what the other party is like. And this is what they tend to do. No, we're all Americans. I mean, it's not. So here, if it's okay to say something a little provocative, because there's the thing about kids, it's one thing if somebody wants to wear a mask when they're taking a nap. On their own. If an adult wants to go to the grocery store with a mask, God bless you, do whatever you want. But when it is forcing kids to do something, that just drives me insane when we are making decisions on dogma against the evidence. And with children and vaccines, there's a big distinction between healthy kids and kids with a comorbidity. And if you downplay vaccine complications, you make the vaccine look safer than it really is. And when you overplay COVID risk in young kids, you make the virus look more dangerous than it really is. And as a result, you have a completely distorted risk-benefit perception of what's actually happening. Can I say something provocative? And I probably shouldn't say this, but let just put it out there. Has any healthy child in the United States ever died of COVID? We don't know. No one can tell you. The CDC director can't tell you because she was asked in front of the Senate. The FDA commissioner can't tell you. That person was asked at the same time. So nobody can distinguish of the deaths in people under 18 in the United States, what percent occurred in kids that were healthy, if any. If nobody can tell you that number, and we know that the numbers we're overcounting COVID deaths in general because when they die for other reasons and they happen to have COVID, oftentimes it was counted. And then we don't distinguish healthy kids from kids with a comorbidity. Could it be that all the children who have died, or nearly all of them, have leukemia or an immune deficiency or metabolic syndrome? Is that a possibility? Absolutely, it's a possibility, because in Germany, where they don't suppress data, they reported that out of all the COVID deaths in children in that country in the first 18 months of the pandemic, when, by the way, none of the kids were vaccinated, none of the deaths were in healthy kids. 100% were in kids with a comorbid condition. It's important because most kids are healthy. We got 40 million healthy kids in the United States. And when you have a vaccine that causes heart inflammation in roughly 2 to 3% of kids who get the vaccine, it's subclinical. Most will never come to a clinic or get hospitalized. But we do know that some young males have died from the vaccine. I'm not trying to scare people or tell people vaccines are good or bad, but this is part of the informed consent. How do you so fervently, as a public health community, and unanimously lock arms and walk off a cliff together, arguing every kid must be required to get vaccinated, when none of those people, zero of those people saying that, can tell you if any healthy child in the United States has ever died of COVID, and they can't tell you what the risk of dying of myocarditis is, even though we can extrapolate that from the literature. The arrogance is what drives me crazy. And it's paternalism. Let's be honest. It's this: people are too stupid to understand that the risk in healthy kids is lower, so let's just make it a universal requirement. People are too stupid to understand natural immunity is very protective against severe COVID, severe illness. So let's just say everyone has to get the vaccine, even if you already have a high number of circulating antibodies from prior infection. People are too stupid to understand. We see this in the medical culture again and again, by the way. I've written extensively about this in my book, Unaccountable, and then again in The Price We Pay. This intense paternalism, often driven by a small group of old white men, if I can be very frank. And look at who's calling all the shots with COVID: Dr. Kessler, Dr. Collins, Dr. Fauci. And so a small oligarchy uses this intense paternalism. We saw it in the past, by the way, with the medical establishment and pregnancy testing. There was this push to get home pregnancy tests so women could test themselves and find out if they're pregnant. And the old guard medical establishment fought and said, no, they can't do that. They can't handle the information. We have to tell them. We saw it again with HIV testing, right? We can't let people find out on their own they have HIV. We have to do the test. We see it with certain prescriptions for common things like urinary tract infection. So this intense medical paternalism has been around for a long time, but I've never seen this level of crushing dissent. For example, Vinay Prasad and Z-Dog and I put out very strong statements condemning hospital visitation policies during COVID. Who the heck are we to tell some 18-year-old they can't say goodbye to their dying mother? Honest to goodness, who are we? If it were my mother on their deathbed, I would have found a way to break in. And so this idea that we can't let you take a risk is this old-fashioned medical paternalism just rearing its head up again.
Yeah, that's definitely an ugly thing to kind of hear, and it's really unfortunate for those people who were unable to say goodbye to their loved ones. And I've heard that story over and over again, not just from physicians but from other people as well, indicating that they weren't able to say goodbye to their loved ones, and it's really affected them. And now they're kind of living with that and living with it in a way that's affecting even their own mental health, because they didn't have that opportunity to kind of close that last chapter with whoever they were trying to say goodbye to. And yeah. I agree with you again. It is this kind of like arrogance and like paternalism that we know better, and just listen to us, and we're not going to have a discussion about it because we already know what's best. And I think that's what's gotten the medical community into a lot of trouble recently, is that we're not having these open discussions. And like you bring up old white men and Dr. Fauci, he wasn't really open to having a discussion with anybody at all. And anytime Rand Paul questioned him or said anything that was contrary, he would end up more or less like slandering Rand Paul personally, and not really giving any way to the science and what he actually had to say. And I think in most of those exchanges, Rand Paul came off, much more scientific and a lot more calm and less emotionally reactive than say Dr. Fauci did. So it's unfortunate that is still being done right now in medicine. And one thing that I on the topic of vaccines that I wanted to mention is this bivalent booster, because there's been a lot of data that has that's come out recently that, it showed that, well, two things really. One is that it showed that it's no more effective against the new variants than the old vaccines, or the vaccines that we were previously giving. So I think that's one very, very important point that people should know. And then the other thing is that people are still at risk from this particular vaccine that they're getting, the bivalent booster, which in some ways was marketed as being safer. So first of all, it's not more effective. It doesn't help against the other strains. And then the other thing is that you still are at risk of particular complications. So it seems like we rushed out one vaccine, and then when we got this new bivalent booster, we've rushed it out again, and the results so far have been fairly disastrous, not just clinically, but from my understanding, the uptake has been very minimal as well. And I was just wondering, what are your thoughts on this bivalent booster, and do you feel that it's something that many people are going to benefit from, or do you feel that it's not more effective against the newer strains of COVID that are now emerging?
So let me answer that question, but let me take a step back and address in general scientific controversies during the COVID pandemic. We could have answered all of them instantly with good randomized controlled studies or other high quality studies of all of this stuff. Masks and whether or not it was airborne versus spread through surfaces. Remember, they were telling everyone to wash their hands like crazy and count to 20 seconds. Okay, I understand if you don't know what's hitting you, right? If you just got attacked by a virus and you're telling people, look, this is the one thing we know. But to peddle that thing for months without doing the research to figure out that it was airborne, I mean, shame on them, right? That's the crime. The crime is that we could have answered the COVID controversies quickly in real time and ended the debate. But instead, our oligarchs in public health chose to rule by opinion and squash dissenting opinions rather than spend their budgets to do the definitive research studies. We saw it with masks, with the ideal vaccine interval. Right? They just said, well, look, it needs to be 3 or 4 weeks apart because that's the random dosing interval that they picked when they did the trial. We now know that the proper interval should be at least 3 months, maybe longer, and that those studies come out of Europe now showing us that the complication rate is lower, myocarditis rates are lower, and the effectiveness is actually higher if you space out the vaccine doses further apart. We should have been doing that. By the way, you can save more lives early in a pandemic when you get more first doses out. I wrote several pieces about that. And so instead of doing research on the ideal vaccine interval, they just ruled by opinion. And they did this over and over again. Well, when you rule by opinion on masking toddlers in school, guess what? You're going to get controversy. You're going to get lots of different parents have different ideas. Where's the data? All of these controversies could have been answered with data. And we're having it again. It's like it never ends. We're having it with the bivalent vaccine. Pfizer and Moderna come up with a vaccine that's supposed to address the new variants. They call it the bivalent vaccine. And we're all opining over it. And public health officials are saying, I think Ashish Jha's famous quote was that the data are crystal clear, quote unquote, crystal clear on the bivalent vaccine. I don't know what he's talking about. We don't have a single randomized controlled trial. Why not? We can't do a single randomized control trial in 6 months of this vaccine being, developed by pharma. And so that is the great tragedy of COVID, is that public health leaders, the NIH with their $45 billion a year, could not do these basic studies. And as a result, you had a void of medical evidence. What filled that void is political opinions. And that's how COVID became the most politicized virus in pandemic history. And and we didn't have to be here. We could have done those great studies. Also, I wish the New York Times would have sent a single reporter to Europe, to a school there that was open free and clear the whole pandemic with no masks, they would have seen there was no difference in transmission rates. That's what the data show.
Where was this story, Dr. Makary? And where?
They never covered this. That's okay. My point is just the New York Times could have sent a single reporter, Washington Post. Instead, they dangled fear of COVID in children like it was, like it was the bubonic plague. All they had to do was send one reporter to a school in Europe, because schools there all over Europe had areas where schools were open free and clear with no masks, and there was no difference in transmission. If a kid gets COVID, it's not more likely to be in the school than when they're out of school. So the media was a big part of this whole thing. They basically did what they did with weapons of mass destruction in Iraq. The government says, hey, we're going to tell you something. You can, broadcast this to the world. There's weapons of mass destruction in Iraq. And they, rather than doing their job as journalists and saying, well, where's the evidence, or what's this based on? It was, hey, this is happening. And, they basically cheered the country on to war. They did it again with COVID. How does Dr. Fauci do 2,000 media interviews and not a single person interviewing him asks, have you been paid by Pfizer or Moderna? Look, if he is paid, I'm not saying it's something he should be penalized for. I'm just saying, how does no one ask him that question? The only hard questions he got was from the Senate testimony. When he left the so-called step down on December 31st last year from his job, no one thought to ask him, hey, are you still working at NIH? Because a lot of people there say he's still a federal employee. And if so, what's your job? Like, what is now that you're not the director, are you just collecting the highest salary in the entire government with no role? Are you an advisor? Are you getting a salary? Because lots of sources, and I wrote about this, say that he continued to be a federal employee, may still be today, but how does no one ask these questions? I'm not saying, look, this is our priority, is making sure he's off the government payroll. I don't have a problem with him staying on, but the issue is, how is there no oversight or accountability by a media where this is their job? Instead, they sort of, are quick to demonize anybody who presents a different point of view. And so the media played a big part. The problem is for them is that it's backfired, right? The media is actually widely distrusted right now, and people have found their own media outlets they trust more.
Yeah, I see that a lot, and I hear that a lot, that people have, a lot of distrust in their government, whether it's in Canada, whether it's in the United States, all over the world, really, people are distrusting their government, distrusting public health because of the actions and the decisions that they've made over the past 2 to 3 years. And the other thing about that is that they're unwavering in their opinion, even in the light of new evidence, meaning that they can say something that's completely inaccurate, and then we can present them with evidence that's showing that it's inaccurate, and then they still refuse to change their opinion. And that, to me, is probably the most dangerous part. Or maybe the more dangerous part is that the public, knowing this, will still believe the same people. I mean, if you meet someone and this person lies to you, the second time they say something to you, you would think that you would question what they're saying. You think that you would look into what they're saying. But it seems like, and I hate to use this word sheep, but, I understand why people are using this term now, is that, many people are, in fact, acting like sheep. They are acting like, the willfully blind. And I think that has, had a very, very detrimental effect overall on the overall consequences of COVID and what's happened to people. And, I don't know how we're going to build the trust back in public health. And even if building the trust in public health is a good thing, because, it would be a good thing if the people who were in power of public health were committed to putting out good information, good evidence-based information, and they were committed to, looking at new evidence and changing their opinion in light of new evidence. But we don't see that from public health. What we're seeing is, people who are taking a stance, and despite being presented with new evidence, will continue on that stance and are continuing to trying to manipulate or trick other people into believing everything that they're saying. And it's unfortunate that that's happened. The positive part is that people like yourself and Dr. Jay Bhattacharya and other very, very credible physicians have now kind of emerged. I think that instead of people watching the 5 o'clock or 6 o'clock news, people are going on to your Twitter account, Jay Bhattacharya's Twitter account, and seeing what they're saying. And it's great for the people who are doing that, but for the people who are not doing that, they're still getting the wrong information and they're still believing the wrong information and acting on that information. And I think that's where we need to make, a real big change. And, and again, I'm very grateful for people like yourself who have come forward, who have, written this book that you have in the New York Times bestselling book, the price we pay, and I think that is something that's going to continue in the future. And we're going to see more, independent media outlets emerge.
Yeah, there's a lot people don't realize. One is that the schools were open free and clear without masks. The other is they don't realize this is the world in Europe, right? That outside of the United States, people are shocked when they find out, oh, actually the governments in Sweden and Denmark recommend against vaccinating young children. They're shocked. Moderna has been basically banned. It's been restricted in people under age 30 or 40, depending on which part of Europe you live in. People are shocked when they find, how could this be? We're mandating people get it. We're actively pushing it, and it's basically restricted in parts of Europe. My favorite study of the whole pandemic was a study done by a student at Stanford. His name is Max Meyer. And he found that in late 2021, of bicyclers in Palo Alto at the Stanford campus, 43% were wearing a mask while bicycling, and only 17% were wearing a helmet. And it's just this intense,
holy shit,
right? It's this myopia that we have. And they're outdoors and they're bicycling, and 43% are wearing a mask as they're bicycling. I mean, that's not, the problem is not them. The problem is the information they have been given, right? And this myopia. Of course, now we're unpacking all the learning loss and the other issues, but it's this sort of distorted perception. Remember when Sonia Sotomayor said during Supreme Court proceedings that there were 100,000 kids in the hospital right now with COVID? The real number was like, 1,000 or something. There was like 3,000 total in a sample over several months. It's like, where's she getting this from? She's been listening to NPR and reading the New York Times. And if you don't know the real data, of course you have this, you're going to be triple masking as you go to bed by yourself. We have a faculty meeting at Johns Hopkins tonight. It's only by Zoom, part of COVID policies or something like that. It's like, at what point are we going to move on? The FDA has 18,000 employees that are working remotely. It's like, at what point, as Elon Musk said, pretend to work somewhere else?
Yeah, that's crazy that they're still doing that. And coming back to that study that you said, 43% versus 17 on, wearing a mask versus wearing a helmet. I've seen that, and I've put it out on my social media before. I saw, a young kid one time, like flying down the road here in London, Ontario. That's where I am. And, like hands off the handlebars, no helmet on, but mask on, so, clearly he's not understanding, how to reduce your risk of a head injury from being on a bicycle. And clearly he's also not understanding how to, not get COVID either, because, your chances of getting COVID when you're riding, on a bicycle by yourself and thinking that a mask is protecting you is essentially zero. Whereas, if you fall off that bike and you hit your head, I mean, you could be in real bad trouble. Head injuries, can be extremely detrimental on people's lives. So, even though you mentioned that and it seems absurd, I believe it right away because I've seen it firsthand.
This is his write-up that he did. This is great. This is Max Meyer, a Stanford student who did this research study. He got the idea because he saw a student on a bicycle wearing flip-flops with AirPods in his ear going the wrong way through a busy roundabout in an active construction zone with no helmet, but he was wearing a mask.
Yeah, I can absolutely believe it because it wasn't the kid I saw wasn't going through a roundabout, but he was coming down a pretty steep street when I saw him. So it's something that I can totally understand and get behind. And on the topic of masks, I kind of find it funny that people call themselves evidence-based, and they'll have it in their profile on Twitter and that kind of thing. And then if you mention any type of treatment that has even, several randomized controlled trials, but hasn't been implemented into the curriculum yet, the guidelines, they'll say, oh, that's quackery. We need more randomized controlled trials. You can't say that. Yet, when we look at masks, from my understanding, there's only been 2 randomized controlled trials on mask, the Denmark study and the Bangladesh study. And from my understanding, one of the studies showed that essentially, the masks don't do anything. And then the other study showed that masks do very little, except if you're wearing N95, it might protect you between 10 to 11% in high risk areas. So it's kind of, funny and ironic that, the same people will say that, vitamin D doesn't have enough evidence. We don't have randomized controlled trials on it, which we actually do. There's tons.
Yeah, we do now. Yeah.
We have tons. Yet they'll point to a lack of randomized controlled trials on masks and say that, this is why, they need to be so it just doesn't make any sense whatsoever. Right. Yeah. So I'm not understanding their logic. It's like, right. We need more randomized controlled trials for vitamin D, even though we have plenty. But we're going to say that masks work, even though the 2 randomized controlled trials that we have show very, very poor evidence for it. Right. So it's silly.
I wrote about this in The Price We Pay with appendectomy for appendicitis. So it turns out this is like one of the most common procedures in America is having your appendix removed for appendicitis. Turns out there is a strong view in the medical community. It's a minority view, but it's very prominent in Europe that you can actually give people antibiotics initially for straightforward appendicitis, and you'll cure them like 2/3 of the time. They'll never need surgery. And you don't lose any time. You don't get behind the 8 ball where they get so sick that there's worse outcomes. It's worth trying if you can give someone antibiotics and observe them for 12 hours or sometimes 24. And so we would discuss this in the United States, and people would just trash on the idea, right? Just how dare they? And this is, non-evidence based, and there's no studies, and that's why we don't do it. Well, then studies started coming out like, hey, look, here's hundreds of people that we've successfully treated with antibiotics and they never needed to come back for surgery. And by the way, if you have straightforward appendicitis, you want to ask for antibiotics as first-line therapy. Well, then the American surgeons were like, well, this is not a randomized controlled trial. This is anecdotal and it's a case series. We can't trust it. So then a randomized controlled trial was done and published in one of the top journals, medical journals. And they said, well, there were some issues with the randomized controlled trial. I need to see a second randomized controlled trial. Then a second randomized controlled trial was published in JAMA. And they were like, well, there's no good long-term follow-up. Well, actually, there was some good long-term follow-up in there. So a third study came out with long-term follow-up and another randomized controlled trial. At this point, it would be unethical to do more randomized controlled trials. They're in our top 3 journals. They're great studies. They're large. They're statistically valid. And it's like, look, just be honest. If you don't want to do antibiotics for appendicitis, if you just don't like it, if you're biased and prejudiced, all the data in the world will not convince you, this is a futile excuse that you're offering. This is childish, it's immature, it's paternalistic, it's anti-science, and it's wrong. And this is exactly what we've seen. Today, majority of people with appendicitis in the United States are still getting surgery. I've written about this extensively. And so this is a long-standing story in medicine of, as we started off talking about, if you like the results of research, then you praise it and endorse it. And if you don't like the results, then you find something wrong with it. And that is not a healthy place to be. That's where we are in medicine today. And it's all over. It's with food as medicine. It's with diabetes care. It's with general body inflammation. We saw it with the vitamin D study, right? Why are we learning 3 years into the pandemic about the randomized controlled trial on vitamin D? Why didn't Fauci fund that in month 2 of the pandemic? This is the sort of a frustrating thing about modern American academia in medicine right now.
Yeah, the last time I checked a search on PubMed, there was the last 3 meta-analysis on vitamin D all signaled that it had benefit. And also too, there has been some time where people have actually been low in vitamin D and then they've gotten treated with vitamin D during the infection. So even, prior, so we know that we think that prior to getting infected would be best. But even if you are infected with COVID and you get a bolus early, there is some randomized controlled trials that have shown that it can be, effective overall. And I think that, coming back to your point, and I've mentioned this before too, like, I think that a lot of physicians don't want to admit that vitamin D is effective, partly because it's sort of, damaging to their ego and their, and their own presentation, meaning that, there's like, 18-year-old health and wellness bloggers like 3 years ago that were probably saying like, hey, get your vitamin D, this is going to be effective for you against COVID. And so, a lot of these physicians don't want to, they think that if they start talking about vitamin D or reducing weight, that they're going to somehow reduce their intellectual capacity that they're, displaying to people because they're talking about vitamin D and weight loss instead of, some randomized control trial on a new drug. But, the reality is that, sometimes simple interventions are the most effective, and they're also the ones that are, they may not be easy to implement, but they are implementable. So yeah, sure, you can't lose, 20 pounds overnight. We know that, but, COVID has been going on for 3 years, and we know that, weight loss and reducing your weight and taking better care of yourself is certainly linked to, better overall COVID outcomes. And that's almost, common sense. So I think that there's, a lot of physicians out there who, don't want to admit that some of these simple interventions that, people with maybe very little education were kind of spitting out early on were actually very effective. They don't want to admit that. And that's, unfortunately, I think the reason why a lot of these interventions are still not being discussed, because even last year, our own health minister in Canada called vitamin D fake news. And I imagine now that if we had that conversation again, she would probably say the exact same thing again. And if they ever even do admit that it is, an effective intervention, I think they're going to go back and say that, we didn't have the research at the time, which again is a lie. If you look at the research over the past few years, there's plenty of signal that indicate that vitamin D, would be beneficial for preventing severe disease and COVID.
And if you're a public health official and you're hearing, hey, people are turning to vitamin D and I don't like it, and they shouldn't, do the study, do the research study. I mean, that's the biggest crisis we had during COVID is they weaponized research dollars. They've got $45 billion at the NIH. And in year 1 of the pandemic, The National Institutes of Health spent twice as much money on aging research than they did on COVID research. And so they decided to rule by opinion. Look, vitamin D does not make any pharma executive rich, but other patented products do. And so you would completely ignore the role of weight loss and exercise and managing obesity, and instead just push every single person down this pharmaceutical pathway. And this is not just COVID. This was a perfect storm of a fault line we had in American medicine before COVID that just turned into a giant earthquake. And that was, we turned to pills for everything. We have the most medicalized, the most medicated, the most disabled, the most obese population in the history of the world. And how are we trying to manage it? The medical establishment, more drugs and surgery. We just saw it with the American Academy of Pediatrics saying, hey, we're going to tackle childhood obesity, right, by pushing more drugs and surgery. Oh, and they give a little lip service to lifestyle. How about the fact that you guys, the American Academy of Pediatrics, ignored sugar addiction in children and school lunch food for 60 years, which created this problem, right? Obesity is by and large a byproduct of sugar addiction. And we all grew up with it. We're the first generation in the history of the world that uniformly grew up with a massive glycemic addiction. We've never studied the long-term effects of it. And people are wondering, hey, why does 25% of the public have metabolic syndrome? Well, nobody at the American Academy of Pediatrics did a study to put this together or take leadership on this role. And so they give it lip service. And now they're saying like more drugs and surgery. Same thing with anxiety. Same thing with, sometimes what we're doing in modern American medicine is absurd. Look at what we're doing. We're testing the wrong types of cholesterol in the blood and putting people on meds without the appropriate assessment of apoprotein B and lipoprotein A.
I love that you said that because I'm a big fan of ordering those two tests. So
yeah.
I really appreciate you saying that.
Well, I like what you put out there. I like your advice. I like that of Peter Attia, a good friend of mine who puts out some really good stuff on health.
I really like Dr. Attia and the stuff that he says. So yeah, I didn't know you guys are friends. That's fantastic.
Yeah, both of you are very aligned on a lot of this stuff. So this is what we should be talking about. I mean, really what he is putting out is an indictment of the modern medical establishment, pushing the low-fat diet for 60 years. They still do it. And so we need to be talking more about treating diabetes with cooking classes, not just throwing insulin at people. We need to be talking about treating obesity with addressing school lunch programs, not just more drugs and surgery for kids. We need to talk about treating high blood pressure by addressing sleep medicine and stress management, not just pouring more antihypertensives after antihypertensives at people with hypertension, first line after second line after third line. We need to start talking about environmental exposures that cause cancer, not just the chemotherapy to treat it. We need to finally start talking about food as medicine, including funding research on food as medicine. You're not hearing this. Instead, you have this pharmaceutical-driven, pill-popping culture in the United States, and it's not going down a good road. In some cases, we have the medicalization of ordinary life. I mean, I'm doing research now on childbirth. It's a topic I've really been interested in from a public health standpoint. I'm working with an maternal fetal medicine OB doctor. It's amazing what we've been doing for 50 years. It represents almost the assault on newborn premature babies, routinely intubating them, putting them on antibiotics for no reason, cutting the cord as soon as we see the umbilical cord. Oh, there it is, cut it. I mean, what are we doing? It's pulsating stem cells and fetal hemoglobin and nutrients and warm fluid into the baby. Why are we cutting off an infusion of warm fluid to then separate the baby and try to warm the baby under a French fry light in the back of the room? have the mom hold the baby, right? There's something magical about bonding. What have we been doing? And now there's good best practices in OB. There are baby-friendly, good protocols. And unfortunately, they're just not adopted at the rate. They're not talked about. We've got good research around this stuff, but the adoption rates remain low. So this is why I talk to the public. This is why I write books. This is why I'm out there, because there's a lot that we need to do to change our sort of thinking in the culture of medicine.
I agree. And just one, I know we only have a few minutes left, just one point on the preventative medicine piece and the diabetes. Like a lot of people, a lot of physicians will have a patient that has an hemoglobin A1C of 5.1, and then the next patient will have a hemoglobin A1C of 5.8, and then they'll treat that patient as if they're the exact same. Now, neither one of those patients has diabetes, and even at hemoglobin A1C of 5.8, you're still pretty far off 6.5, which is the cutoff we use for getting for being diagnosed with diabetes. But if you're at 5.8 and previously you're at 5.7 or 5.5 before, I mean, clearly you're going in the wrong direction. And as soon as someone shifts direction, that's when you should be making the change. You don't wait until they go from 5.1 to 6.5 or 7.0 and then start treating them as a diabetic or start giving them medicines. Then what you do is you start when they start shifting at all in the wrong direction. So when they go from 5.1 to 5.5, I mean, you got to put a stop to it there, and then start making interventions at that point. So I totally agree that we don't have real good preventative medicine practices, and it's something that absolutely needs to be addressed. And I wish we had more time. I'd love to talk to you more about preventative medicine and things beyond COVID. So I am appreciative of those topics that you brought up today. But Dr. Makary, where can people find you online? Where can they get your book, and where can they find out more about you?
Well, great, thanks. I'm on LinkedIn and Twitter. I try to put material out there frequently. I write for a bunch of newspapers. I go on. I try to talk about the stuff I'm passionate about. And the books are Unaccountable, which is about the medical establishment. If anyone's seen the TV series The Resident, it's in part based on Unaccountable. It's a lot of the same characters with the same names. And then most recently, the book The Price We Pay is around the modern day medical establishment, how price gouging and predatory billing have dominated American medicine, what you can do to push back with your own medical expenses and bills, and also the movement within medicine to change all this, because there's a giant movement, and we're doing our best to spearhead a lot of this. We call it the redesign of medicine, the redesign of medicine. It's not preventive medicine, but it includes that. It's not holistic medicine, but it includes that. None of those terms really capture what we're talking about. We're talking about changing the entire system, reinventing it, starting over. And there's some great examples in the United States of amazing healthcare sort of utopias that are happening on a small scale. And we just got to really encourage those things, empower physicians, educate patients, and talk about care before it presents to late stages. So we're not just playing whack-a-mole. We're talking about food as medicine and other things. So that book is called The Price We Pay. Both are New York Times bestsellers, and both are available pretty much anywhere.
Well, thank you so much for your time today. Thank you for educating everybody. And I really appreciated this conversation. And for everyone listening, I'll be back again next week.
Thanks, Mike.